Well, the biggest thing that I find is, number one, that the patients can have control over what they eat, and that there's more and more research out there that the role of nutrition really does impact the immune system and how much inflammation is going on in our body, and that a lot of autoimmune diseases are affected by this chronic inflammation, and the way we can reduce that the most is using food as medicine instead of a lot of different types of drugs and interactions. Just eating healthy can really go a long way to impact the disease process and the severity of the disease. And that's always the big question, right? Is what can I eat? What can't I eat? And there's no research out there that has put somebody on a diet with MS and followed them longitudinally and said, okay, this is the diet. I think it's a very personal choice. People eat what they eat depending on their culture and their background. But in general, there's some research out there that salt is not the best thing for patients, moderate salt intake or sodium intake in general. A lot of people think, well, I don't salt my food, but it's a lot what's in the food. The sodium actually stabilizes food, so they put it as an additive in a lot of places. So just being aware of that and looking for that. Moderate fat intake, there's a lot of things out there that omega-3s, which are in your fishes, are really, really good for the immune system, which they are. And then limiting trans fats, so that's the other big thing. You can find those all in processed foods, so I say just take the processed foods out, you'll probably limit a lot of those things. And then sugars, I think sugars are a big problem in America. We just really like sugar, so to limit sugar is probably very helpful. It does a lot to the immune system that's in the negative aspect. And then lastly, increasing fiber. A lot of Americans do not get enough fiber. A lot of people in the northern hemisphere in general don't get enough fiber. So increasing fiber intake helps get those nutrients absorbed correctly and then out correctly. Well, it helps with chronic inflammation for other diseases as well. So cardiovascular disease, high blood pressure, all of those things, it reduces the risk in healthy, normal patients or people. But people with MS have an immune system that's already overacting or not modulated correctly. So if you're also then adding this increased inflammation by food, you're almost dysregulating the immune system even more. So it's not that it's going to cure the disease, but it'll certainly help symptom management-wise, and then make the patients obviously feel better. Why add obesity to what you're doing? And not even obesity too. Some people are skinny, but they aren't eating the right things, and they're this ongoing process in their gut where they think, oh, I just have irritable bowel syndrome, or I just have colitis, or there's just all these different autoimmune diseases that start in the gut that we can kind of damper down, so then people with MS don't have to deal with those as well as their unfortunate disease process in MS. So.